Hey everybody, Dr. Schultz at the Centeno Schultz Clinic with a quick April update. Hard to believe that spring is finally here. Thanks for checking in. So, foot pain. Foot pain can stop you literally in your tracks. I don't know about you, but I'm on my feet all day, and some days I go home and my feet are on fire. So, what I want to briefly discuss are common causes of foot pain and one that maybe you and your doctor haven't really looked at. So, let's take a quick dive. The most common, or one of the common causes of foot pain are shoes. Guys are knuckleheads. We get into the same shoes every day. That's right. We just kind of by default get into one. But you need to rotate your shoes. You need to have a good quality shoe and you need to rotate it. So footwear is very important. Many patients, because of their anatomy, need to have orthotics. So that's also a consideration. Number two, the foot can actually have arthritis, just like the knee. So don't be surprised that one of the causes of foot pain is arthritis actually in the joint. Number three, ligaments. Ligaments are the duct tape that hold things together. That's right, the duct tape. So if you have an ankle sprain or a sprain of some of the ligaments that hold that foot together, you can actually create a significant source of pain. And the acronym is SALT. And then tendon. Tendons are basically what connects muscle to bone. And the most common one that we all know about is that Achilles tendon, that big rope that's it connects on the backside of your heel. Well, SALT, shoes, arthritis, ligament, instability, and tendon. Those are the common causes, and that's what most people get treated for. But you know what? Right here, that's right here, the low back can actually be causing your debilitating foot pain. It's hard to believe, but this is how it works. This is this is the low back. These are the building blocks. In between the building blocks is a cushion. The cushion is called a disc. If you look at to the side, there's little keyholes. We think of these as doorways. What's coming out? Nerves. These little nerves go down into the leg, into the calf, and to the foot. So if you have actually an injury, compression of this lowest or second to lowest disc that's irritating the nerve, guess what? You can have resulting foot pain. So be comprehensive. Here at the Centeno Schultz Clinic, we never have blinders on. We, in fact, look from head to toe. We examine that and put the pieces together to give you the very best clinical results. Common causes of foot pain, SALT plus lumbar. So I hope this was helpful. If it was, share it with others. I'll see you next week. Thank you.